Now, the Doctors Association UK has helped to create a free app to help get personal protective equipment to frontline NHS staff fighting the coronavirus pandemic. The union claims that there is a significant shortage of PPE to keep workers safe. That's despite assurances from the government that there is enough. It claims it has heard from doctors who have been bullied or shamed into not wearing PPE due to shortages. Well, joining me now is a frontline NHS consultant and law and policy lead of the Doctors Association UK, Dr. Jenny Vaughan, who's in South London. Dr. Vaughan is also coordinating the PPE campaign. Very good afternoon to you, Dr. Vaughan. I want to start by asking you for your reaction to the sad news from the Health Secretary this morning that 19 NHS workers have now lost their lives from the virus.
Well, we are incredibly sad to hear those figures. We believe we have concerns that actually it's more than 19 deaths at the moment. We also have concerns that those figures perhaps don't include pharmacists, allied healthcare workers and care home workers, because we've certainly heard stories about them not also having access to PPE. And the reason we've created this free app, NHS PPE, which was done in conjunction with Mesley, that's a group of junior doctors who've developed this, is because what we want to do is help fill some of the gaps and be part of the solution. There is no doubt that the main responsibility for PPE rests with the government, and things have begun to improve. But what the government needs to admit is that there are still gaps, and we have to encourage staff to speak out and put the power in their hands, and this app does this. We are then working in partnership with NHS Hero Support, a voluntary organisation, and Let's Beat COVID, as they are now going to help us supply some of the areas that we've heard through the app where they haven't got PPE. They will then help target the supplies at those areas, because that will, as far as we're concerned, a single life that we can save on the front line due to supplying extra PPE, that's got to be worth doing.
Yeah, Dr. Vaughan, I mean, this app is pretty much in its nascency, isn't it? But you still had quite a few interesting results coming to you from it. Perhaps you could talk us through that in terms of the percentage of doctors who just say that they don't have basic bits of equipment that they need to be dealing with patients.
Well, it's interesting. It's only been running for just about 10 days through our partnership, and we've had over 1,000 people sign up. We've had over 240 hospitals and GP practices, and from that we're getting figures of between 40 and 70% are saying that they don't have access to long sleeve gowns, and 43 to 50% are saying that actually they haven't got any access to eyewear. So we are getting some extraordinary figures back, although we accept that actually we do have at the moment a small snapshot, and obviously we're attracting people who actually don't have what they think they should have. So we're actually reporting people who are signing onto the app. However, there are clearly gaps. We know there are gaps, and we also know, and you referred to people being bullied. We think it is an absolute right that if our healthcare workers are putting their lives on the line, and tragically they are, we've heard that, we know that, and we know that sadly the figures will keep rising. If they are in that position, they have every right to speak out in a constructive way, which they are doing, about what they see as the gaps, because they must be protected when they go into work and looking after everyone else. We see it as our job to help look after them.
And Dr. Vaughan, and the Health Secretary was indicating that there was enough quantity of the equipment, that the problem was getting it to the places where it needed to be, which is, I know, one of the main ambitions of your app. What do you think about the overall quantity? Is there enough?
Well, the thing is, it's all about what's getting to the front line. Now, at the beginning, we were told that there were some local distribution issues, and those have actually improved since the government got the army to help out with distribution. But we are still hearing reports of people not having enough equipment. So as far as we're concerned, although we absolutely acknowledge that things have improved, there's still many, many gaps, and we can't afford gaps when it comes to people's lives. So we're going to keep going.
What do you make of Matt Hancock's comments, which I think he's tried to row back from somewhat, that perhaps the equipment isn't being used properly or that it's being overused and that's why we're getting through it quicker than we would?
Well, I think nobody should be trying to blame healthcare workers here. They're on the front line. I think what he was trying to point out was that, the problem is the guidance has been a bit confusing. Originally, there was one set of guidance and people were using gowns and they were using what we call FFP3 masks. And then the guidance changed and it appeared to a lot of healthcare professionals that they may now be less protected as a result of the new guidance. Now, again, the guidance has changed again and it has become more protective in certain areas. So the problem for healthcare staff is that there has been a confusing picture here, which we hope is now becoming clearer. But I don't think that anybody, it's interesting that he has rowed back and I'm pleased that he's done that, because what we should be doing at the moment is doing everything we can to support care workers on the front line, feeling confident to do their job, to save as many lives as possible, and to feel protected and not feel, and remember they're also covering sick colleagues at the moment, and we also know that they are really tragically having to look after their colleagues, in some cases on ventilators. Imagine how that feels. So I think at the moment we should just be doing everything we possibly can to support them.
OK, well, we certainly salute you and all that your colleagues are doing, and thank you very much for your time, Dr. Jenny Vaughan.
Thank you very much.